Hello, I'm Dr. Thomas Serena, and I'm the founder and CEO of the SerenaGroup family of wounded hyperbaric centers, and you're in a SerenaGroup center at your current hospital or private clinic. Welcome to our centers. Your doctor has prescribed hyperbaric oxygen therapy. Let me walk you through HBO. The procedure takes about 2 hours in total. You're going to be asked to put on a gown with nothing else on. We don't want anything going in the chamber that is prohibited, and the technician will go through the prohibitive items list with you. You're going to get to be friends with the hyperbaric technicians as they go through their checklist every single day. Once you're appropriately attired, we're going to place you into the hyperbaric chamber with a band on your wrist, and that's a ground. It's very important for the safety of the chamber, and we want you to leave it on. We'll then close the chamber, but don't worry about that. The technician is always readily available, and if you want to get out of the chamber, we're going to allow you to get out. We don't want you to get out of the chamber before you've received the dose of oxygen that's necessary, but if you really feel like you have to, we can do that for you, so please don't worry. On top of the chambers, as you can see, they are completely acrylic, or you can see right through them. You can watch television. It's actually quite relaxing, and I've done it myself and fell asleep. You're welcome to fall asleep as well. What happens inside the chamber? Why is this so important? Well, we fill the chamber up with 100% oxygen. When you're breathing oxygen under pressure, it forces oxygen into your bloodstream, and that is the magic of hyperbaric. That's how it works. If you look at it from a physiologic standpoint, what does all that oxygen do? Well, most importantly, it grows new blood vessels. So if you're being treated for a wound, it'll grow blood vessels into the wound, help it to heal more quickly. If you are being treated for the late effects of radiation, for example, then it will grow blood vessels into the area that was injured by the radiation that you received for your cancer. Now, hyperbaric oxygen therapy is a commitment. It's every day, Monday through Friday. And as I said before, it takes a good 2 hours to get undressed and get in the chamber, and by the time you get redressed, it's probably 2.5 hours in the center every day. It's important that you come every day. This is a dose of oxygen. It's almost like a medication that you take. And the dose, it needs to be done in a very specific way, once a day, 5 days a week. Now, we realize that there may be times when you'll miss a treatment here or there. That's fine. But for the most part, it is really essential that you come every day, Monday through Friday, for the treatment so that you can get the exactly right dose. The dose that we know from multiple clinical research studies that demonstrate the best benefit to you. Let's talk briefly about risks and benefit. The benefit of hyperbaric oxygen therapy, as I mentioned, one of the big benefits is the large amount of oxygen that goes to your tissue and how that drives new blood vessel growth, or the word of the day, angiogenesis, which is that new blood vessel growth. What are the risks? Well, actually, when you look at the risks of hyperbaric, they're very rare. The most common risk is you'll have a problem with your ears. There's this airspace in your ear, and the pressure can sometimes cause the eardrum to be sore, and you might have to be referred to an ENT physician to have that treated. That doesn't happen very often, but it may happen to you. If you have problems with your ears during the treatment, you need to let the technician know straight away so we can address it. The technicians and physicians will be looking in your ears periodically to make sure that you haven't had any problems. Have you ever flown in a plane and when you land, you feel that pressure in your ears? That's the same idea as being in the chamber. Then you may feel that pressure. And the technician will go through a series of methods to clear your ears, as we say. I like this one. Works really well for me when I'm flying. Other complications in the hyperbaric environment are really rare, and your physician will discuss them with you. If you're diabetic, your blood sugar may get low. And if you feel hypoglycemic in the chamber, you need to let the technician know straight away. On rare incidents, you may have trouble with shortness of breath. You may even have a problem with oxygen called oxygen toxicity, which can lead to having a seizure. That's extremely extraordinarily rare. If you look on the consent form, it also says you may have a collapsed lung. But I can tell you in the large study of over 1 million patients, it didn't happen. So it's more of a theoretical concern. The real concerns about risk are related to your ears and your sinuses and making sure that you can clear your ears. And if you come in one day and you've got a lot of sinus infection or a lot of buildup, you may not want to be treated that day, or perhaps the physician can prescribe some medication to open up your sinuses. If you have questions about your hyperbaric treatment, feel free to speak to your technicians. They've been well educated, and your nurses and physicians in the Wounded Hyperbaric Center. And of course, you can always contact me. I'm Dr. Thomas Serena. Thank you.